Hi everyone, it's Pete again from the Pain Toolkit, and today I'm still with Dr. Tim Williams, and today we're going to do another question really. The question today, by the way, hello there Tim, how are you today?
I'm all right, thanks Pete for asking.
Fantastic, well done. So one of the questions that came in was how do or should doctors and healthcare professionals explain to patient actually what pain self-management is? Now, before you tell me, because when I do my workshops, I go around the room, because I think me, you, and lots of other healthcare professionals, we use this term self-management. But to me, if you ask anybody in the street, well, what does self-management mean? Now, they seem a bit, well, I'm not quite sure, really. They come up with some really fuzzy answers. And for me, how I tend to explain it is I ask people in the workshop, hands up how many people have brushed their teeth this morning. You know, so hopefully all the hands go up and etc. And then I say to them, why did you do that? And they say, well, it keeps your breath fresh and stops visits to the dentist and stops tooth decay. And I say, well, that's self-management. You know, so what you're actually doing something to look after yourself, really. And the sort of the penny drops really from there. But I think sometimes we get a bit, I don't know, we're expecting the person with, you know, in front of us, understand everything that we're sort of saying. But how do you explain self-management to the patients?
Yeah, self-management with pain, self-management with any long-term condition. What I explain is that although I have a contribution to make, and there may be some medication to prescribe, there may be some other things that I might suggest, that actually people have the most important contribution to make themselves. And actually, I know we've talked about this before, where clinicians spend, or healthcare professionals spend about 4 hours with people with long-term conditions over the year, and which leaves 8,000
757
hours or something like that, where they are not with the healthcare professionals, so they are self-managing. So that's the majority of the time. So it's more, what are you doing yourself? So the conversation will be, what else are you going to do, or what more are you going to do? One of our junior doctors mentioned to me and said, well, the difference I noticed, so when people leave your surgery, they always leave with something to do. And I think that's the key, really, is that if you can use your 4 hours as a clinician with people to support them in the other 8,756, then that's really good use of time. To not do that, I think it's a missed opportunity. So in that time, what can you do yourself, or what more can you do? And that, you know, we have to be gentle with people, because people aren't necessarily used to that kind of way of being. But it's really important. People have the biggest contribution to make to their long-term conditions.
I totally agree with you. And I remember someone on a workshop years ago saying to me, do you know what, Pete, you know, self-management for me is taking action. And I think that is the key, and I really remembered that, and I use that again with other people. Self-management, about taking action. And that's what I do, I guess, you know, to self-manage my pain and healthcare conditions. I'm doing something each day to keep everything sort of in its place, really, you know, keep the pain levels down and all that sort of stuff. Hey, Tim, it's been good talking to you again. Thanks very much for that. And hope everybody's enjoyed that. And we'll both see you on another Pain Toolkit broadcast soon. Bye.